Say something if you can hear me. Hi, guys. If you can hear me, let me know. Come on in and join How Do I Study Pharmacology? There was 154 comments when I asked who is struggling with pharmacology. So I hope you guys get to tune in today for this valuable information that I'm about to give you, because that's what we do here at New Nurse University's Nurse Renee's study group. Okay, we study to save a life and we study to understand. If you can hear me, okay, I see somebody said they can hear me. If you are a new nursing student and you have not yet started classes, this is something you want to tune into, something that you want to watch over and over again. If you are already inside classes for your program, then this is definitely something that you want to tune into as well. Even if you're studying for NCLEX, please, by all means, tune in and you'll have valuable tips that you can use over and over again. So I'm going to teach you today how to study. That's what I like to do. That's what I specialize in. So if you don't know how to start pharmacology, or if you are in pharmacology and you just don't understand some of the concepts, then by all means, ask questions. Ask your questions here. This is going to be for you. This is how you understand the concepts of pharmacology. So I'm going to let for more people to get on. If you have any questions, please put them in the comments. Okay, if you have any questions, go ahead and comment questions. Questions here. Sorry. This is going to be for you. This is how you. All right. So I'm going to go ahead and get started. If you can see my screen, let me know if it's too small or if I need to make it bigger. This is our focused worksheet that I will be teaching from today. And so it's very important to have organization. It's very important to have organization and clarity when you're studying. A lot of you guys don't have clarity when you study, all right? You are all over the place. And that's one characteristic that you want to have, is being organized. So I try to come on here and give you like little templates, little formulas that you can use over and over again, just for when you get unorganized again or unclear, or just to clear some things up. Okay, somebody said make it bigger. Okay, let me see if I can make it bigger. Okay, so that's as big as I can get it. Let me see if I can take me off the screen. Hold on one second. I just need to. I was looking for my logo to put up here, but I don't think I see it. So I'm just going to not worry about it. Do you have any questions so far? So when I ask people when they're struggling with pharmacology, or what are they struggling with, I always get pharmacology. And that's not a real answer. I need to know specifics. Be specific. There are many parts of pharmacology that you could be struggling with. Okay, are you struggling with the 5 rights of medication administration? Do you struggle with knowing what's inside the classification of a set of drugs? Do you struggle with, just knowing how to relate them to the proper disease and learning how to pick up on, maybe the signs and symptoms and stuff like that? That's more specific. That's the stuff that I need to know so that I can help you. A lot of people just be vague and say farm. So let's break it down. And that is what my sheet is doing here today. Oh, I'm covering the board. Okay. So let me see if I can get that off of here. Let's see, cancel that, cancel this. All right, so you guys, you can hear me now, right? If you can hear me now, type yes, please, in the comments. All right, so you guys, you can hear me now, okay, right? Can you see my screen? I'm gonna try to get this right, y'all. Okay, so you can hear me, but the screen is smaller. But you should still be able to see the screen pretty good, right? You can still see this screen pretty good. I see it. It's big enough. Okay. So, guys, what I was saying was, for the new nursing students that may have not started a nursing pharmacology class yet, or may have not started their program yet, this is how you're going to help them. Please engage with us by putting the 5 medication rights to administration in the comments so they can read it later, okay? What are the 5 medication rights to administration? Now, for everybody else, this is nothing new. You've heard this. You've been through your program. And this is something that is important. Okay, so we're just going to break down these pharmacology terms and study techniques today. That's all we're doing, because I need everybody to get clear, and I need everybody to have clarity when they are approaching pharmacology. So with that being said, 5 medication rights to administration. Put them in the comments. Someone put them in the comments. Now, look at this. Pharmacokinetics. This is a term that describes what the body does to a medication. Okay, why is this important? Why is this important? See, it's not enough just to know the endings. You have to know what is going on with your patient after they take a medication and what their body is going to do to that medication. That's why in pharmacology, we learn the different medication routes. When you do the oral route, it's an easy thing to remember is ADME, A-D-M-E, absorption, distribution, metabolism, and excretion. What nutrients are being absorbed when you take this medication? Right? How is it distributing the nutrients to the body? So let me give you an example. Vitamins. If you take a multivitamin, let's say you take one every day, okay? You are digesting this multivitamin. It has to go through your digestive system. So when you take medications by the oral route, it will go through this ADME process: absorption, distribution, metabolism, and excretion. You guys need to remember that. Okay, so, and then one thing too is first pass effects means concentration is greatly reduced. The oral route greatly reduces some of the medication concentration, which means less indicated, less, less effects of what you wanted to do. Does that make sense? So this is something that you have to pay attention to. Anytime you hear the word pharmacokinetics, it just means what the body does to the drug. Period. That's it. That's simple, right? And then you can just remember the acronym ADME: absorption, distribution, metabolism, excretion. And just know that if you take a vitamin, and here's your example, if you take a vitamin every day by the oral route, it's being digested. Okay, it's going to be absorbed. Then it's going to be distributed to where the nutrients needs to go. And then it's going to break down and be metabolized. The waste is going to go its separate way. The nutrients is going to go another way. And then your body is going to eliminate it, which is excretion. Period. This is something that you should have in your notes. What about the IV route? Okay, the IV route bypasses the ADME phase, the digestive phase, that the oral route takes the medication through, right? And so the IV route, it bypasses the digestive phase and goes straight in your veins, straight in your bloodstream within a matter of a couple seconds. And you have to know, once you push that IV medication, IV push that medication, you can't take that back. No matter what anybody says, you can't take it back. It's gone. You can try to draw it out, but 9 times out of 10, the damage is going to be done by the time you get the antidote pulled from wherever, or, all of that. So you got to be careful with these IV push meds. Your examples: if somebody has high blood pressure, guess what? They may have to IV push labetalol. Okay, your famous LOL, right? Your famous LOL medication. And we'll get into that in a second. So if you're going for surgery, the nurse may have to push IV push famotidine. Yes, it comes in an oral route, but it's surgery. What if it's an emergency surgery and anesthesia needs to put you down right away? Famotidine is like I'm not going to explain what it is. If you guys know what it is, please put it in the comments. That's how you can engage with me today. If you know what labetalol is, for the new nursing students, write what it is in the comments. Write like what it's used for. I want you to write what it's used for in the comments. Okay, so what is labetalol used for? What is famotidine used for? And then what if somebody is in severe pain, like you have a sickle cell patient and they're in severe pain and you have to IV push morphine? What is morphine used for? And can somebody tell me the classifications? What is the classification labetalol is under? What is the classification famotidine is under? What is the classification that morphine is under? These are all IV push medications, and you need to know the IV route bypasses the digestive system and it goes into your bloodstream. What about IV medications that are needed on a pump? And I give you some examples here. What's the classification and indication to Pitocin? What about potassium riders? What about magnesium? Those are all medications that need to be on a pump. You cannot free flow them. You cannot bolus them. I mean, you can bolus them, but it has to be on a pump. You can't put those to gravity because those will kill your patients, period. Okay? Am I making sense to you? Is this helpful to you guys? Just by breaking it down like this. So right now we're on the 5 rights of medication, 5 medication rights to administration, and pharmacokinetics. Pharmacokinetics, just to recap for the new people that are coming in, is what the body does to the drug. And you have different routes. That's where you have to learn your different routes. When you're in a nursing program, you're in your nursing classes, you got to know of different routes. I only posted 2 here, which is oral route and IV route, but there is a rectal route. Somebody tell me what medications go up the rectum? What medications go up the rectum? It's important to know your routes just because of the pharmacokinetic idea, the definition, okay? What the body does to the drug, okay? Oral route is going to go through digestion. IV route is going to go straight to the bloodstream. The rectal route does something else with your absorption. Okay, I think that goes straight to the bloodstream as well. So it's important to know your routes because of pharmacokinetics. And then know your antidotes. That's important. And there are worksheets all over the internet that you can Google, and a list of your antidotes will come up. You don't have to rewrite it if you don't want to. Just get a list of them and post them up somewhere. And then so let's say you go in the refrigerator 3 times a day or however many times, post it on your refrigerator door. That way, when you walk up to it, you can see those antidotes, read them real fast, get what you need, and go about your day. But that repetition, I guarantee you're going to be remembering that on your test. You're going to be remember walking up to your refrigerator, reading those antidotes, because your brain remembers engagement, okay? So let's see. Let me read the comments real fast because I asked people to put things in the comments. So can somebody please put the 5 rights to medication administration in the comments for the new nursing students? And then can somebody please put the classification for labetalol, famotidine, and morphine? What are those classifications? And then potassium, I said potassium, potassium, and magnesium. What are they used for? What are their classifications and indications? Okay, I'm going to move on. Pharmacodynamics. If you see this word, do not freak out. Do not become confused. Just learn what the definition is. All it means is what the drug does to the body. It's the opposite of pharmacokinetics, right? Pharmacodynamics is what the drug does to the body. At first, we were looking at what the body does to the drug and how if it goes the digestive route, it is greatly reduced in concentration. Or if it goes to the IV route, how the bloodstream absorbs it super fast. Now we're talking about what the drug does to the body. So this is where you have to know your mechanism of action. I had a post in a group where they were saying that their teacher was reversing the mechanism of action. Okay, cool. If you know normal versus abnormal, which is a study technique that I ask everybody to incorporate into their study sessions, you will be fine. Mechanism of action is just what happens when the drug binds to a receptor site. What happens when the drug binds to a receptor site? Okay, all over your body, in the inside, we have receptors. Okay, and we have it's hormones interact with receptors, enzymes interact with receptors, the whole 9 yards. That's anatomy and physiology. If you want to go review that, go to a YouTube video really quick so you can refresh yourself. But so mechanism of action is just what happens when the drug binds to a receptor site. If you have pain somewhere, right? Let's take our sickle cell patient. They have sickle cell pain in their legs, right? And we want to administer this morphine from earlier, right? Because now we know. Did somebody put in what morphine is? Come on, guys. You are watching me. Please engage with me. Please, in the comments, put these answers that I'm asking for. I'm starting to think that you guys don't appreciate my free stuff. You won't engage with me. Okay, anyway. So we have a sickler. They're in pain. Their pain receptors are going crazy. They get IV push morphine. The morphine is going to go through the bloodstream and bind to the pain receptor sites. Okay? It's going to block the pain receptor sites. It may not be for too long, but it's going to block those receptor sites. That is what morphine does. It's supposed to take away the pain, right? Okay, so mechanism of action, you just need to know that if you're giving a narcotic, which is, or an opioid, because that's what they call it, if you're given an opioid, which is the classification of morphine, it's an opioid. If you're giving an opioid, you need to know that the mechanism of action for morphine is to take away the pain. It's an agonist. It's going to take away or block, inhibit something. Okay. That's the therapeutic effect. Did the drug work? That's something as a nurse that you have to identify. You have to give the medication. Then you have to go back and reevaluate your patient after you give it. And that's where we use our pain scales, right? You see how all this is tying in together if you have taken pharmacology, a pharmacology course, all right? Then when you are evaluating your sickler, you're going to say, hey, I gave you morphine about 15 minutes ago, 15 minutes to 30 minutes ago. How bad is your pain on a scale of 0 to 10? That's when you use your pain scale, right? To reevaluate if the drug or medication you gave was therapeutic. Okay? Then you're going to say, all right, assess their side effects. Is the morphine giving this sickler any side effects? Or she's going to say, I feel nauseous. All right, you feeling nauseous. When did that start? Being nauseous is a common side effect. Even if it didn't go the oral route, it's still messing with those receptors, right? Morphine makes people nauseous. It's a very common thing you would expect from a person that just got morphine. Now, if you assessed her prior and her vital signs were, if her respiratory rate was 12, if her respiratory rate was 18, and now you're assessing her and now her respiratory rate is 8, you have a problem. That is an adverse side effect. Morphine also makes people kind of like slow down in their respirations. And so that's something else you have to go back and evaluate along with the pain. Okay, so now side effects. We have a common side effect, which is nausea. We have an adverse side effect because now her respirations are 8 and they're going down. What are we going to do? What is the antidote to opiate medications? What's the antidote to all opiate classified medications? I'm not even going to say just morphine because it's not, you got to get out of thinking of one medication because there are a group of medications under that classification where an antidote will work for majority of them. So what is the antidote for the opioid classification? Does anybody know? Thank you. Somebody finally put the 5 rights to medication in the comments. So 5 rights, let's recap really quick just for the new nursing students. It says the 5 rights are right dose. You have to make sure it's the right patient. You have to make sure it's the right route. Okay. The right time, the right medication. Yes, they are adding rights. I think a 6th one is documentation. But for now, we're just going to focus on the 5. Right person, right route, right dose, right time, right medication. Okay? So that is your 5 medication rights to administration. And now I'm going to tell you why that's important. I'm going to tell you why. Well, it already tells you up here. You can spot when to question the doctor, and you know when to administer, hold, give, or give with parameters. That is why the 5 rights to medication administration is important for you to know, so that when you have questions, when you have exam questions on pharmacology, and when you have NCLEX style questions that you do in your home or in a library, wherever you are before you get to NCLEX, you're preparing for NCLEX. It's important to know 5 medication rights to administration and follow directions and pay attention to those keywords, because if they give you an order and the doctor ordered this, but the route is missing, you need to be able to pick up on that. And the only way you're going to be able to pick up on that is if you know your 5 medication rights to administration. Okay, so I'm going to put it here. So these are the things that you should be, what did I say? Patient route, dose, time. Patient route, dose, time. I forgot what the last one is. I know when I see it. Oh, medication. Thank you. Okay. So these are our 5 rights to medication administration, and then these are going to help us identify when we have to question a doctor on, hey, let's clarify this. This route is not right, or this dose is too much, right? Or this patient's heart rate is this, but you know that the medication is going to make the heart rate go down even further. Should I give or should I hold this? Or this patient's platelets are 95,000, but they're getting heparin. Do we hold or do we give? You see what I'm saying? So it's very important to know your 5 medication rights to administration, and to pick up on in your questions when to question a doctor, when to administer, when to hold, when to give with parameters, okay? Let's go back to antidotes. I was asking for the antidote to our sickler who says, hey, a side effect that I'm having is nausea, but you assess her vitals and her respirations are at 8 and it's going down. You assess her again and now they're at 6. So basically she's headed towards respiratory distress if she's not short of breath already. So what is the Narcan? Thank you. Narcan is the antidote to opioid classified medications. Remember it that way. It's not just for morphine. Opioid classified medications. Okay? You got to think bigger. Stop trying to memorize individual drugs. You'll drive yourself insane. Okay? So let's move on. I'm hoping the examples that I'm giving are okay. because that lets me know if you're understanding what I'm telling you guys. So let's go back over this. So labetalol is a antihypertensive. It's a beta blocker. And it's used for hypertension. That's the indication. The indication is we use it for people that have high blood pressure. And the classification is a beta blocker. I didn't need to know that the ending was LOL. I understand it's a quick way to know a medication, but what if they give you a beta blocker without the LOL part? Then you're screwed. You've limited yourself. So always find an alternative way to learn something. Not just the way that it's a quick fix and it's not going to help you in the long run. Famotidine, okay, I think it's a H2 receptor. Let's make sure. But I know that it's indicated for gastric. Yeah, it's a H2 blocker. Okay, a H2 blocker, and it blocks the production of acid. So when people go to surgery, if the anesthesiologist don't want you throwing up, you know, what you done had 2 hours prior, they're going to try to, they're going to give you this medication to block that acid production. Okay. The classification is a H2 histamine blocker. Oh, histamine 2 blocker. It's called H2 blocker. That's the classification. The indication is to block acids production in the stomach. Okay, and then morphine, I already said, was what? Opioid. The opioid is the classification. Indication is to reduce pain. Pitocin is a tocolytic. No, I think it's a uterotonic. It's a uterotonic. That's the classification. Okay, a uterotonic stimulates the contractions of the uterus. That's what we use it for, to stimulate contractions in the uterus. Potassium riders. You know, if a person has hypokalemia, they get potassium IV on a pump. Always. You cannot bolus potassium. It will kill your patient. You cannot bolus Pitocin in a pregnant mom. It will kill the baby. Okay? You got to think about that. It's two patients you got to take care of. Magnesium. You can bolus magnesium on a pump. If you free flow to gravity, you will kill your patient. You will make them stop breathing. Okay? So breaking this down and knowing this is very important. Next is therapeutic drug levels. It's also under pharmacodynamics. We have to think about our seizure patients. We have to think about our people on warfarin, right? What is the peak and trough level that is supposed to, there are thresholds that seizure medication has to be built up to in order for it to work. Same thing with warfarin. In order for it to work effectively, like how we want it to be therapeutic, it's a certain level that we have to monitor. That's also important, and it comes under pharmacodynamics. Now, let's get into bad study habits. What bad study habits do you have? What bad study habits do you have? Well, I can think of a few. Memorizing endings and prefixes because your teacher told you to. Or somebody said it was a good idea to just memorize the endings. But all medications do not have the same ending. Or it can have a similar ending to another medication, which would be totally wrong. And don't sabotage yourself like that. Study, that's what I mean by study to understand. Memorizing helps for the moment, maybe, if you don't get confused. But studying to understand and breaking it down like how I just did, and practicing. You're not going to get it overnight. Practice. Practice going back to your notes that you write down, if you're going to write notes. Or practice listening to this video. No matter how many times you listen to the video, you're always going to find something new. Okay? So memorizing endings, that's a problem. Memorizing prefixes, that's not enough. Solution, make pharm more relatable to you. Remember how I said go to the refrigerator and post up your antidotes? You go to the refrigerator all the time. Or on the back of the remote, take a piece of paper and tape it to, if you even still use remotes, I don't know. Or put a sticky note up on your computer or your laptop with, the therapeutic drug levels of seizure medications, or your warfarin therapeutic drug levels, right? Or your common side effects, which are nausea, vomiting, diarrhea, constipation. Those are the things that you're going to see in people that are expected versus the things that are unexpected or adverse, which is what? Name some adverse side effects that you get from medications. Something that is not supposed to happen. Think about severe adverse side effects. What you got for me? Oh, somebody said cramming. Yes, cramming works for the moment. But if you want to be able to teach your patients something, it's not going to work. You have to understand what you're giving your patients so they can say, well, I don't take that. Or if they say, why are you giving me this? You need to be able to explain why you're giving it to them, what you're using that medication for, what it's going to do to them, how it's going to make them feel, and to let you know if they have any extra problems, right? So this is why you need to study to understand pharmacology. All right, and I know this is not fancy, but this is all I got to teach you guys with. So, but make pharm more relatable to you. And then I put the example up here of how many medications are in your medication cabinet right now, if you keep medication in the medication cabinet. I know I have ibuprofen, Tylenol. Somebody said Tylenol. I have, laxatives for constipation, yes. What else do we have up there? We have vitamin C, vitamin D. Like, make that relatable to you. Learn what is in your cabinet first. That's a more structured way of learning. Okay, what is the classification to the medications that are in my cabinet? Okay, some of you have Motrin liquid. Some of you have Robitussin, cough syrup. Read it. Read what the classification is. Read what it's supposed to do to you. So I have an example here, and I'm not going to keep you that long. So it says, just memorizing signs and symptoms will hurt you also. All right. Don't try to learn a medication just by memorizing their signs and symptoms. Understand common versus adverse. For side effects, for medications, I'm sorry, I'm getting off track. Just memorizing signs and symptoms or just memorizing side effects for medications is not going to work. You need to know the bigger picture, and this is the bigger picture here. The study technique that I want to teach you is learn from classifications. This is not nothing that you already haven't heard, but do it this way. Mechanism of action, what the drug does inside the body. Go learn, go seek that out. Get curious. Indications, why am I giving this? This is what you have to ask yourself as a nurse. Side effects, what do I expect to see? Okay, and then that's common. And then adverse effects would be, what don't I expect to see? So did anybody write any of the adverse side effects? Anaphylaxis. If you give a drug and this person's lips start swelling up and their eyes shut closed and they're as big as their face and they can't breathe, that's an adverse side effect. And they need to be intubated right now, like right now. Okay, so loss of consciousness. If you're giving a drug, if it's not a sedative already, they should not be losing loss of consciousness, or they should not be disoriented to the point where you cannot arouse them. That is an adverse side effect. All right. Sometimes rashes can be common, but it is adverse. All right. If you have a rash sometimes, I know vancomycin causes that red man syndrome. But see, we expect to see that though. The doctors expect that and they prepare accordingly. But something like, if you give a Tylenol and your patient is hypotensive off this Tylenol, something wrong. That's an adverse side effect. Okay, they had a bad reaction to it. So here's what I want to show you. It says learning study technique. Learn pharm by classifications. This is how I want you to look at pulling out the information. You know, I always give you ways to pull out the information. And yes, you can do this in your Saunders book. Saunders has medication chapters after every disease process. And even if you're not in pharmacology class right now, go through the classifications. Just look at how they build out the pages. All right. They have a box where they list all the drugs, and then they're going to tell you, just like this, what to expect. Right. It may not be verbatim, but they're going to tell you what your interventions are as a nurse. Okay. You need to know what the drug does inside the body, which is going to be your description. You need to know why you're giving the drug. You need to know, what do you expect to see? What don't you expect to see? Intended effects that are abnormal. So complications, contraindications, right? Patient teaching. If you're cramming this stuff, if you're cramming pharmacology and you're cramming pharmacology and you're memorizing, you're not going to be able to teach your patients. You're not going to be able to teach your kids if you have kids, what the medication does. Okay, you want to be so sharp to the point where, hey, yeah, I know what this does. Let me teach you how to use it, right? Person has a rescue inhaler and they put it to their ear. What? You have to be able to teach your patients how to use things. Okay, especially that spacer. Y'all ever got a NCLEX style question where it says, this inhaler has a spacer? Drag and drop the directions. You're like, come on now. That's why it's important to know. Okay, so I was gonna run through a let me share my screen. I have another appointment here, but I'm gonna share my screen, and let me see, where is it? Here. Okay, so check this out. This is a little bit more organized, and this is how you want to look at your pulling out of the information. So you have pharmacology focused worksheet. This is going to be in my new membership for nursing students only, and it's also in my NCLEX Bootcamp Club, where we focus on pharmacology like this. Now, in order to tackle pharmacology, you want to be able to fill in the classifications on your own. That way you create notes. All right. So in the programs that I have, this is your template. This is your guide that you get that you can use over and over and over again. And when you feel like you don't know a classification, this is how you present your notes. All right. Classifications, drugs, indications, contraindications, mechanism of action, side effects, adverse effects, nursing interventions, patient teaching. This is everything that you would like to pull out. Is it time consuming? Hell yes. But if you do the work, you show up, do the work, put in the effort, make the notes, you're always going to have them to fall back on. This is your backup plan. This is how you get strong in pharmacology. If you don't hear anything I'm saying to you today, know this. You will be strong in medications if you do it like this. Okay? You don't want to be on the floor and you weak in medications and doctors are calling out medications and you in a code and you have no idea what they're giving your patient. Not saying that you're going to be giving them the drugs, or not saying that somebody's not going to be around to help you, but at the end of the day, you need to know so that you don't kill somebody. This is important. Okay? So I don't want to keep you too long, but I do want you guys to think about joining the Ultimate Nursing Student Club if you are a nursing student in the program and you want all of my mini classes plus my full classes in one spot. Okay? That is up on my website, and I will provide the link for you in the comments. Now, this is also in my NCLEX Bootcamp Club. It's in their organizational planners. So let me see. And I have videos going over how to tackle pharmacology. Now, on NCLEX, are you going to get drugs that you know? Absolutely not. Absolutely not. But you will be able to figure out the other stuff, right? Because of the keywords in the question. Because they're saying the nurse should know side effects. What are the side effects? Or this patient is saying I'm having these issues. Okay? Or what do you teach this patient about this drug? And then if the answer choices are all grouped together, guess what? You're going to be able to figure it out. But not if you don't practice this stuff. I'm telling you. Not if you don't practice. You can't go over it once or twice and then think you got it, think you know it. No, it takes 30 days to make a habit. And you need to sleep, eat, breathe pharmacology while you can. Okay? So I'm going to stop sharing this now. So I hope you enjoyed today. I have another appointment to go on right now, and leave me some feedback, please. If you want to know more about the clubs that I have, I will just inbox me. And I hope that this was helpful to you, and you guys have a good night. I think this went for like maybe a little less than an hour. So thank you for tuning in to New Nurse University with me, Nurse Renee. Have a good night.